Medicare is health insurance that is paid for in part by the federal government and available for people who are age 65 and older, for people who are under age 65 and are on disability, and for people who meet other special criteria such as having end-stage renal disease. Medicare is broken down in 4 parts, each represented by a letter, often referred to as Part A, Part B, Part C, and Part D. Understanding these 4 parts helps you understand what you have and what you need. Let's review the 4 parts in more detail. First, there is Medicare Part A. Part A helps to cover some medical costs when a person is admitted into a hospital or a skilled nursing facility, requires rehabilitation services, home health services, or hospice care. Next is Medicare Part B. Part B helps to cover doctor visits and other medical services like x-rays and lab tests that your doctor sometimes asks you to take. Part B also covers medical equipment such as diabetic supplies and wheelchairs. Medicare Part A is typically paid for when people reach age 65 if they have been paying Medicare taxes while working in the United States. People are required to pay a monthly premium to have Medicare Part B insurance. The monthly payment amount is based on a person's adjusted gross income that was reported to the IRS in a tax return 2 years ago. More information on this can be found at medicare.gov by searching on Part B costs. Next up is Part C, also known as Medicare Advantage. Medicare Advantage is offered through individual health insurance companies, not the government. In addition, those individual companies may provide additional benefits that Medicare Parts A and B don't cover, and sometimes will pay more for medical services so that an individual can pay less for necessary care. When an individual pays for part of their medical services and the insurance pays for another part, this is known as cost sharing. In addition to having possibly lower cost sharing and added benefits, some Medicare Advantage plans will also include prescription drug coverage. This takes us to our final part, Medicare Part D, known as the Medicare Prescription Drug Program. Part D is pretty simple and can be purchased as a separate insurance plan known as Standalone Part D, to go with Medicare Parts A and B, which do not cover prescription drugs by themselves. As we mentioned, you may not need to purchase a standalone Part D if you purchased Part C, Medicare Advantage, and it includes benefits for prescription drugs. While those are the 4 parts of Medicare, there is one more option or type of insurance that people can buy to go with Medicare Parts A and B and Part D. This is called Medigap, or also known as Medicare Supplement because it goes with general Medicare. Medicare Supplement, like Medicare Advantage, is offered by individual insurance companies and not the government. It helps to pay for the portions of medical services that Medicare Parts A and B don't pay for, or the cost sharing that individuals pay when they have Parts A and B. Important note: people don't have both Medicare Advantage and Medicare Supplement. So you should choose one or the other, not both, if you want more than general Medicare. So those are the 4 parts of Medicare and some information on Medicare Supplement. It is good to know you have options. And we also know that options can sometimes mean confusion. We hope this brief time was helpful for you. If you want to learn more, visit AskBlueMedicare.com for more information and details.